Hello, I am so happy to be here. My name is Suzanne, and I am from Health Improvement Visionaries. And on this channel, we aim to support you folks in NGO, whether you are in health or any other sector, but we are looking at how to fill those gaps in healthcare so that we can provide even better service to our communities of color, racialized communities, key populations, indigenous, black people, brown people, everybody. Our communities are all in need of stronger health systems, and that's why we're here. And so today we are focused on five practical tips for NGOs boosting funder confidence. And we all know that we want to be an agency that our funders are confident in our service delivery, in our processes, whether financial or otherwise. So we're looking at securing funding for NGOs and just looking at these strategies. So I am using this app, and I am hoping that it will work. Let us go to the first practical tip. Wonderful. Okay. So the first tip that we're looking at is crafting a compelling mission story, right? And I know that this can be an area where we struggle, right? I'm reminded of my story, even starting this channel and going into consultancy. Like, what is my story? What's my compelling story? What is my pitch? Now, as an agency, you have a stated mission, right? Now you need to develop the narrative around your mission story. And that narrative should be a concise story that highlights the impact of your work on real people and on your community. So you need to synthesize all that data that you have that highlights the impact of your work. The second thing under creating that compelling mission story is to gather evidence, right? You need data. You need to be able to show what your work has produced. And that could mean collecting testimonials. It could mean creating case studies. It could mean just actual data that you're using, statistics, right? That demonstrates your agency's reach and its success. And then the third point here is practice and refine. And it's really like sales, right? It's about crafting that elevator pitch. No one has, humongous amount of time to look at or listen to, this long, my son would say, diatribe of story around where you are and where you're going. So once you have synthesized all of that data, all the stories and testimonials, you can craft it together for an impactful and compelling mission story. Okay, so what's number two? Point number two. So again, point number two has 3 points under strengthening partnerships and community support. So, number two in practical tips for boosting funder confidence is strengthen partnerships and community support. And we do this in three ways. One, we form alliances. We align ourselves with others, right? We build relationships with other nonprofits, with other health organizations, city council, and these elected officials. We can build alliances with community leaders, and those help to create a strong network. There is no need to choose between, okay, let me align myself with this body or with these community leaders. You can align yourself with everyone that supports or share in your mission, your vision for your organization. So that's very important. One point is that we need to collect endorsements. And I remember writing a grant for CDC, and I think that was the first time. Yes, I think that was the first time like I actually had to like ask my team to reach out to our partners to get letters of support. Letters, LOS they call it for short, LOS. Some of them I wrote myself, some my team members wrote, just asking for letters of endorsement. And what I found here is that sometimes they reply and they ask you, can you give me a draft, a template? So I had to just create a template and send to them, and then they inject what they have into that letter, and complete it, sign it, send it back. So we were able to use those LOS as part of our funding proposals. And the third point under strengthening partnerships and community support is showcase demonstrate that your NGO is part of a larger trusted ecosystem committed to addressing community needs. And this is very important. So not only are you forming alliances and having those alliances endorse you, but you need to show that you are part of this larger network. And so for me, I remember joining initiatives. So whether it was for viral hepatitis, it was for HIV prevention, whether it's diabetes prevent, whatever it is, forming or aligning yourself into these ecosystems that are committed to addressing community gaps. So that is very important. So that is point number 3. Point number 4, demonstrate financial transparency. And this is your agency, the systems that support the functioning of your agency. So one, clear reporting, provide detailed financial reports and budget breakdowns. You should have strong financial team here to do these activities for the agency, right? Because this is part of building credibility, not and also part of transparency. Project budgets, using templates to show projected budgets. I remember also for another funder, federal funder, HRSA, I initially when I wrote the grant, I utilized a particular budget template. They approved the grant, so we got awarded the grant, and that was just like so momentous for us. But at the same time, when they approved it, they actually said, oh, this is not the template that we required. This is the template we required. And so we had to utilize their template. But you must have a budget template to utilize. Financial audit reports. Every state and federal grants that we applied for, they required audit reports. And for the last 3 years. So every time I knew I'm going to write a grant, or I am supporting the writing of grants, an email or just a conversation with finance to just let them know we will need these documents, because it is standard, quite standard. So that was point number 3. Point number 4, showcase data driven impact, and that underpins your proposal. Your funding proposal must show data from your past projects, your past agency interventions. It has to show that you know what you're doing utilizing this quantifiable data, right? So whether you are in a federally qualified health center, a community health center, or you're utilizing an EMR, you're utilizing an Excel spreadsheet, if you're in NGOs, whatever you utilize to collect your data, you have to make sure that you have captured it in a way that now you can present it, you can tell the story, right? You are able to visualize your results, you're able to use graphs and charts and infographics to tell your story. And you are also highlighting your metrics, right? Whether if you're in health and you're looking at HIV prevention, you might want to be looking at your screening rate. You want to maybe looking at the number of newly diagnosed persons you have treated, number of persons who are on medication, ART. You maybe want to look at your suppression numbers. So you are now utilizing your data to underpin and highlight those very important matrices that are aligned with the funder's priority, right? So this is very important. Here we are going to talk about continuous improvement and learning. And this is very important to me. Why? Because I consider myself a continuous improvement expert. And what do we mean by this? A lot of funders want to see how you are incrementally improving on what you are doing. In healthcare, we have not achieved the level of um, output that we would want. We are not seeing the level of health improvement across all communities. We are not seeing that. What we are seeing is persons who are not well from preventive illnesses, people who are dying from preventable illnesses. We are seeing persons who are on multiple medication when they don't need to be on those medications. We are seeing so many ill health, mental illness. We are seeing so many things in our society that says to us our people are not well, right? And so, as funders, you want to make sure that we are seeing or that you are demonstrating this incremental improvement in what you're doing. And so, you can be doing that through staff training, right? Regular staff training. Make sure that your team is fully equipped to do and deliver what they are supposed to. We are also wanting to see feedback loops, right? How are you utilizing your systems to build on each other? Integration of care, not only of care, but of systems, right? So, systems integration is very, very important. And then also data analysis. We want to see how you're utilizing data to support the work that you're doing, identifying gaps through your data, seeing cohorts of persons who are in need of additional support, and then using that data to support the initiatives for new interventions, new activities. It could also be the modification of activities that you already have, right? Diversifying, expanding into different communities, locations, that type of thing. And that's where community improvement is a big, big help. So I want to thank you for just joining for this short session in which we look at the 5 tips that can boost funders' confidence in your agency. I hope you have found this helpful. Thank you so much.